So what is lupus at the highest level? I suppose the simplest way to describe it would be through its pathophysiology. It's a systemic inflammatory disorder. Of course, there are a ton of other systemic inflammatory disorders, both autoimmune and non-autoimmune. This could cover infectious diseases, could cover cancers. So obviously, this is an insufficient statement in order to diagnose this disease, but it's probably the most accurate broad statement. I think the real challenge in lupus is that it can occur and manifest in multiple organs, which then leads to a wide variety of signs and symptoms. Now, the key thing right now in contemporary treatment of lupus is that we want to diagnose this disease early enough because we don't want damage to occur. And of course, damage is going to be irreversible organ injury. And with enough damage, this could lead to mortality. Immunologically, we think about lupus as a very specific disease where autoantibodies to nuclear components, we're talking DNA, RNA, DNA binding proteins, RNA binding proteins, are a highlight of the laboratory aspects of the disease, right? Think anti-nuclear antibodies, think anti-double-stranded DNA antibodies, right? So again, this isn't sufficient, though, to be able to diagnose the disease, and this is the real highlight of this entire talk, which is the second bullet point in the blue bold, right? The challenge in diagnosing lupus, and this is virtually all cases, is that there's no single finding, whether it's in a history, physical exam, or lab test, that makes this diagnosis. And I think this is where a lot of people get very confused about how to get this a patient with what seems to be a confusing presentation of complaints and then physical exam findings along with lab findings, and then how do you get to a diagnosis of lupus or not get to a diagnosis of lupus.